All right. Our next presentation is Dr. Patel, who you all know well. He is the co-chair of our neonatal committee, and he will be talking about the upcoming GaPQC neonatal initiative, Optimizing Nutrition for Georgia Newborns. Go ahead and let you share, Dr. Patel.
Can you see my slides?
Yes.
Awesome. Well, good afternoon, everyone. I'm really excited to share more details about our next initiative for 2022. For those of you that were at our annual conference, you got a brief snippet of this, and we're hoping to give you a little bit more details about this project, what it involves, to hopefully allow you to make a decision about joining on, which we hope many of you will do. So just as a refresher, and I shared this when we had our conference, and this is something for those of you that have been following us along, have probably seen Dr. Levine share over the years, just to give us a snapshot of where we started and where we are today. About 10 years ago, we had the initial creation of the GaPQC with a few pilot initiatives, and then really the first larger effort was on congenital heart disease screening. And then we kind of went through a relaunch, and particularly with the benefit of having funding from the CDC as one of the state perinatal quality collaboratives, and our first project partnering with the Vermont-Oxford Network in 2017, 2018. And this was also the first time we had hospital systems join as an entire system, with the Piedmont Hospital System joining for antibiotic stewardship, and most recently the Wellstar Hospital System joining for our project on neonatal abstinence syndrome. And I think over this time, we've really been germinating and growing. We had 45 centers in Georgia, 45 hospitals that participated in our VAUGHN NAS initiative, and we're now moving in, as we just finished that in September of this year. We're going to be talking about kind of what's next and what's up ahead. But I did want to just highlight, I think it's always great, especially for people who missed the annual meeting, highlight really the remarkable efforts that teams have done at Georgia hospitals over the last few years, particularly in the challenging time of COVID. And you'll see this as we talk about improving nutrition, but it's always great to have a framework for how we want to improve, and really a plan, and that's a key driver diagram. We have used this and gone to this for many of our NAS topics, where we really had an aim for our hospitals to reduce length of stay by about 10%, and to really think about what are the things we can do and interventions that we can do at the hospital level to achieve this. And each of these interventions were tied to micro lessons through the Vermont-Oxford Network, as well as monthly webinars. And we really had an incredible amount of engagement from all of our centers. So almost 2,000 staff at 45 hospitals that engaged with us in the micro lessons, completing over 16,000 micro lessons. So an incredible amount of learning that went on. And 14 of our Georgia hospitals became VAUGHN Centers of Excellence, which is awesome. We also had 17 hospitals with an over 10% reduction in length of stay. And when you looked at infants who met the diagnosis of NAS, comparing 2018 to 2020, about 3 years total of hospitalization days that were reduced. So I think this is really wonderful to see, particularly in the challenging times that many of the hospitals faced with COVID and other strains, that this was really something that hospitals could take pride in working on. So what's next? And we're hoping to, as we transition out of NAS, we know that some centers are going to continue their work on NAS. It's not going to stop, but as a focus for the Perinatal Quality Collaborative, we're going to be really launching next year for a project that's focused on optimizing nutrition for Georgia newborns. This is going to start in early 2022, and we'll have more details coming to you about exactly when that will happen. But really, the goal for today is to give you information about what this initiative entails. And I'll start by saying why do this initiative? And I want to emphasize this is not intended to be a baby-friendly 2.0. This is really focused on harnessing our role as a collaborative shared learning amongst hospitals, really using data and a quality improvement framework to improve specific practices that are important to hospitals to improve. You might, if you joined at our annual meeting, heard Krista Marks, who's at the CDC, who helps run some of the NPINC surveys, which are surveys across the United States of nutrition practices in hospitals. And this was our most recent report card. This was really just released, so very recent data from the 2020 survey, which shows that Georgia scored a 75 compared to a national average of 81. And NPINC is a survey that's done every 2 years, and it's probably the best way we have of the data of a report card for our state. How are we doing as a state in practices and policies that impact newborn nutrition, education, staff skills, discharge support? This is run by the CDC, and so this is our report card. You can see the most recent survey here in 2020. And compared to the prior survey in 2018, we did make some slight improvements in our overall score. One area, and this is what Dr. Marks highlighted, is that Georgia is one of those states that has a relatively low response rate. So only about half of Georgia hospitals are completing the survey. And this gives you a sense of how a variety of different practices related to infant nutrition, how a hospital is doing. And I'm just going to touch on a few of these. We'll have a chance as we launch this initiative to come back to these. The first is actually an area that Georgia saw some improvement in, which was on rooming in practices. But you can see even within our scores that there's still really opportunities for improvement. This is just one that was highlighted, which was, are we doing routine care for newborns in the mother's room? The minority of hospitals were. This is a perfect opportunity for a quality improvement project, of perhaps a change in the process of how lab work is done, and maybe moving that from taking the infant out of the mother's room to changing that so it's occurring in the mother's room. So this is the type of data that can be really helpful for hospitals and for the GaPQC to try to target, what are the opportunities for improvement. This is another snapshot on institutional management. And here, this is, again, snapshots of a variety of different aspects of nutritional care. And the last one here is about written policies. And you can see, consistent with where a lot of hospitals are in the United States, a minority of hospitals in Georgia have written policy elements. This is great for collaborative, for sharing. Why reinvent the wheel when you can share from policies that other hospitals may have on a variety of practices, adapt those to your own needs and to your own setting, or maybe this can be the stimulus to actually talk about those policies and implement them. So this is what Dr. Marks highlighted from the statewide report, which is, I think, areas where Georgia and GaPQC can improve on, and then the areas that we do well on. So there are some areas that Georgia hospitals actually were doing pretty well on. Glucose monitoring, post-discharge follow-up visits, documentation of breastfeeding. And then areas for improvement, mother-infant separation for procedures, formula feeding of breastfed infants, and written policies. And I think these are where I think we hope as a collaborative to try to tackle some of these things over the next 2 years. Now, your hospitals, if you submitted this survey, will actually get a report. And you may not know this, and it's great to reach out to your leadership to actually see if your hospital has their own report, where they'll actually give you a score for your own hospital and actually measure how your individual hospital is doing for the variety of these practices. And I would really encourage hospitals to see if they did submit NPINC data, if they've had a chance to review how their hospital does. And this really gives you a nice way to benchmark how your hospital is doing compared to the rest of the country. So how can we improve? And this is where I think we really have a lot of opportunity as we move into our next collaborative. And really to take this with a quality improvement lens. And I think we are at the heart of Perinatal Quality Collaborative, and we want to take this, we want what's best for our infants and our mothers, and using the principles of quality improvement to really apply quality improvement science to have improvement. So this initiative is going to have quality improvement at its core, and we have kind of 4 broad principles that we set out in designing this. We wanted to have quality improvement at its core. We want to have, you have to have data collection, but we really want teams to spend time on improving and not spend all their time on collecting data. And so we really have been very thoughtful in terms of what we're asking for teams. We want this to be applied to the variety of settings in which Georgia newborns are cared for. We know that from our NAS work, we have a wide variety of levels of care that have been involved in our initiative among the 45 hospitals, and we want this to be applicable to all those levels of care. And we also want flexibility because we realize that some hospitals are strained with staffing, and this might be a difficult time to launch a new effort, and so we have built in some flexibility as well. So for quality improvement at its core, we really spent a lot of time very deliberately over the last several months in reviewing the target populations, metrics, approaches, the duration of initiatives, data frequency, and structures of other perinatal quality collaboratives. And those are from efforts that other states have done focused on nutrition, infant nutrition in California, Ohio, Tennessee, North Carolina, Illinois, Massachusetts, and Florida. And we took all of that information and very deliberately used that to try to inform how we structured this initiative. And we start, and this is always, I think, an important way to start. This is you'll recognize this from our work with NAS of kind of having a framework, and this is a key driver diagram of a specific and measurable aim. Here really focused as a kind of a collaborative aim, although hospitals may have individual areas of focus, a collaborative aim focused on what infants are receiving as their first feeding. 2 other measures that are going to be tracked, really as a broad effort to improve breastfeeding and other outcomes for both babies and mothers in Georgia hospitals. And then to try to address primary drivers. And we realize that hospitals aren't going to be able to address every single one of these. So what we want is for hospitals to really pick what they think are the biggest opportunities, where they think they might have the most impact with the potentially the lowest barriers. And each of these drivers can be addressed by a variety of different interventions and structured in a similar way to what we've been doing for the last 2.5 years for NAS, that over the course of these 2 years, and this is a kind of a draft of our first year, we're going to have very tangible, practical change ideas and interventions and learning that are going to be specific to changes that could be made to improve a variety of these aspects for hospitals, with the understanding that some of these may or may not be appropriate for different contexts of care, or some hospitals may have already implemented some but not others. But we think this is a framework that will allow us to address a lot of important practices and interventions related to infant nutrition. And tied with this will be a very concerted effort to look at data and to look at how we're doing as a collaborative. So we also been very cognizant about minimal data collection, but as we're coming off our Vaughan NAS initiative, we have gone from kind of rather infrequent reports, really looking at what other states have done as they've worked on this through their perinatal quality collaboratives, really that we need enough pace of data to show that we're actually improving and making that the changes we're doing are leading to improvements. And that's really at the core of the model for improvement is looking at, well, what are we trying to improve? And I think this middle green circle, which is how will we know if we're making an improvement? And we have to have data to show that. And this is, I think, going to be at the core, is to have data to show if the changes we're making are leading to an improvement. And then a number of webinars and learning that we'll go through. What are the changes we can try to see if we can make that improvement? And we want this data collection to really be minimal. And we've been very intentional at this. And our goal was to really have only ideally 1 hour per month spent on collecting data so that we can answer that question of how will we know if a change is an improvement. And so this is the data that we're asking. And we've taken an approach of sampling. Sampling allows you to get just enough of a denominator, enough numbers to get an idea of how you're doing. How's your hospital doing month to month? This could be for 2 different settings, either an intensive setting in your hospital or a well mother-baby for well newborn setting, or some hospitals might like to participate in both, in which case they would do 2 audits. And what we're asking is for each hospital to over the course of a week, very similar to the Vaughan audits, to sample 10 infants who are in the hospital on that day. If it's a low volume hospital and you only have 4 or 5 infants in the hospital that day, then it might take 2 days to do it. And we're only asking for 3 pieces of data on those 10 infants. Their breast milk expression or feeding within 6 hours. Did they receive any formula within the last week? And what was their first feeding? And was it human milk? These are the 3 measures that we think, when we looked at other states, we looked at kind of what are some of the key measures in improving infant nutrition. These were the measures that were consistent across many state collaboratives that I think we thought could be easily extracted from the medical record and not take a large amount of effort. That data then would be entered 1 time per month, nothing identifiable. This would be aggregate data where we would be asking about where the audit happened. And then if there was a sample of 10 infants over 1 week, and then you just list the numbers of infants that met those criteria. So you just, out of the 10 infants you sampled, what were the number that met these metrics? This will allow you to get a sense of actually how are you doing on a month-to-month basis. Very powerful to try to guide improvement efforts, and also as an aggregate to let us know how are we doing as a state. Over time, this is going to be kind of the core for any hospital that participates. Over the course of the first year, we will have we have a plan for more expanded data collection that will be optional. That will include things such as primary language and maybe some additional specific measures for hospitalized infants who are in the hospital for more than a week, but those will be optional. And this is really key for us to show every month how we as a collaborative are doing, and also for you as a hospital to use that data to see how you're doing. Number 3 is really to have flexibility in the setting that this might occur in. And so this is going to be applicable to either for really any setting in which a hospital wants to improve. And we know that this improving nutrition is really a broad focus that can involve time before birth, during the NL course, after birth, but really our focus here is on the inpatient hospital setting. We realize this is a very broad, very broad scope, and so we really want to be focused. This is where our teams have been working. This is where we are a hospital-based, birthing hospital-based quality collaborative focused on hospital-based improvement. But we also want to partner and align with the work that other groups such as the Georgia OBGYN Society, the American Academy of Pediatrics Epic Breastfeeding work are doing in other settings, and really not to be duplicative, but really to focus on infants in the hospitals. And we also realize there's a broad array of different providers. This is going to differ on the variety of hospital settings that are going to be involved in improving and working on infant nutrition. We understand that this will be very context specific depending on the hospitals and the teams and the settings in which they work. But our ask is that for hospitals that decide to join on improvement, that there needs to be a champion with at least a physician or advanced practice provider on the team. And that's been based on recommendations from other states where this is one of those key pieces that's been found to be important for success on improvement. And then the last is we wanted to build in flexibility, because we do know that there are some hospitals that might have staffing strains. And we realize that not every hospital might be able to participate fully, but we wanted to have flexibility to allow them to join and learn. And so we have 2 tiers that we have for this project. The first is an active improvement team. And this will have 3 requirements, and I'll go through that in the next slide. The second is a learning collaborative, which will have no requirements, but an opportunity to join, to learn, but not carry any requirements of hospitals. So we hope that many of you will choose to be part of an active improvement team. And the 3 requirements, the first one is to have project champions. And the 2 champions could be any primary hospital contact for the initiative, that might be people who are already the leads for the NAS initiative, or somebody new, but the primary person that's going to be the primary kind of champion that's going to be the communication. It's going to communicate with the GaPQC, and then a physician or advanced practice provider. The second is that there should be hospital support for this at the senior leadership level. That could be a unit director, nursing manager, a hospital administrator. And the third requirement is that there's a commitment to tracking and submitting data once a month. And this is really because we want to be a data-driven quality improvement initiative. We made this as minimal as possible, but this is really a commitment we need. It's going to be, we try to be as parsimonious as possible, so about an hour a month. But these are the three commitments we hope for improvement teams. We also have the opportunity to join as a learning collaborative, and this is for centers that can join us on monthly webinars, much like they've done for the NAS initiative. Join us at our annual meeting. There's no requirements for data submission, but there'll also be no QI coaching, and this might be for centers that desire learning to, but aren't potentially don't have the capacity at this time to join in on collecting data and working on improvement. And centers might join the learning collaborative and then decide over time that they'd like to become more involved, and that I think that's also appropriate. Now, just to highlight really the wonderful engagement we've had with learning and what I think excites me about this effort. This is just as a refresher of how many staff at hospitals were involved in learning as part of our NAS initiative. So I think there is this desire, and our goal is to design our content to be flexible so that individuals who can't make monthly webinars can access content, and to make it in duration in which it can be consumed, much like the Von micro lessons. We're really wonderfully grateful for the partnership of two colleagues from the Georgia AAP, Claire Eden, who's the EPIC breastfeeding director, and Dr. Carolyn Fairley, who's the breastfeeding committee chair of the Georgia AAP, who are really serving as content experts who've done have a lot of expertise and will be serving on this initiative, as well as the team that's worked so far on kind of helping to structure this. And we would love to have those of you that might be interested in joining on. I'll share it on the next slide. Particularly Kimberly Ross, who helps everything run smoothly centrally at DPH. And so this is where we are now, which is we'd love to hear if you're interested about this. You can scan this with your phone and submit an interest if your hospital might be interested. This is not a commitment. This is just an expression of interest. You can also email Kimberly Ross, and this might involve people at your hospitals that might be different than those that have been working on NAS. And so we would also like if potentially you might not be the person that's interested, but you think there's other colleagues in your hospitals that would be interested in this, to let us know so we can have their contact information and reach out to them, and also to include them in our GaPQC email list as we grow and engage people who might be different than those in our past couple of initiatives. So I'm going to stop. I'm going to leave this up and pause here for questions that you might have. And if you don't have questions, you can always email us and reach out specifically for questions. We think there's a lot of opportunity really to take a very data-driven effort to show that we're actually moving the needle on these measures, which is very different than just doing an educational initiative and stopping there. And we hope that this is going to be valuable for centers, and also potentially be a framework for other improvement efforts they desire to do down the road.
Thank you, Dr. As Dr. Patel mentioned, if you do have questions, you can put them in the chat. We have a few more minutes, and we have one more presentation. We'll get through. You can put questions in the chat, or you can email them to me. I can pass them along to our chairs, get you an answer, but just, of course, reach out with any questions you may have. So now, in our last couple of minutes, we wanted to take a few minutes to recognize the people who received neonatal awards at the GaPQC annual conference in October. You can never celebrate accomplishments too much, so we wanted to make sure everyone heard the folks who were awardees. If you're on today and we acknowledge you, if you want to turn on your camera, you want to give a wave, we'd love to see your face. We'd love to clap for you. We're just thrilled with all the accomplishments that we were able to share at the annual conference. So first up, and we are we're sticking with the neonatal awards too, the War Maternal Awards, but you can recognize them on the, don't want to steal their thunder from their webinar. The Dedication to Neonatal Quality Improvement Award. This award was given to 2 hospitals who were committed to achieving our aim to decrease length of stay among newborns diagnosed with NAS by 10%. Based on our analysis, 1 hospital was able to avoid 210 days of hospitalization through their NAS improvement efforts, saving babies, families, and insurers unnecessary time in the hospital and reducing the average length of stay for infants by 57% from 39 days to 17 days. Also of note, we had 15 hospitals with a 20% or greater reduction in length of stay, which we estimate saved almost a year. Yeah, that is great. Of additional hospital days, almost 351 days. So this award for neonatal quality improvement goes to Piedmont Rockdale Hospital. Yay. And this next hospital demonstrated a commitment to learning and building capacity through completion of the Vaughan micro lessons. Their team members completed a total of 3,459 micro lessons in the NAS education and NAS education and training. We proudly present this award to Wellstar Kennestone Hospital. Congratulations, Dr. Kennestone. Again, if you're on, hop on, unmute yourself so your video pops up on our screens and we see you. Next up is the GaPQC Commitment and Engagement Award. These hospitals have demonstrated a sustained commitment to the initiatives by participating and presenting on monthly webinars, sharing resources, and focusing on improving health equity. We appreciate everything you've done to strengthen the collaborative and enhance our work across the state. These awards were presented to Emory Decatur, Liberty Regional Medical Center, Wellstar Health System, Augusta University Medical Center, and Northeast Georgia Health System. So congratulations to all of you, and thank you for your commitment and engagement to the collaborative. Next, yay, our next award is recognizing the hospitals who participated in the NAS initiative that reached Center of Excellence status. These hospitals participating in the initiative work to raise the standards of care for NAS to improve patient and family satisfaction, keep infants and families together in the care setting, and reduce length of stay and length of pharmacologic treatment. We are excited that we reached 14 centers of excellence. These centers include, read them all, Augusta University Health System, Coffee Regional Medical Center, Colquitt Regional Medical Center, I love the applause, Crisp Regional Medical Center, Emory University Hospital Midtown, Irwin County Hospital, Memorial Hospital and Manor, North Fulton Regional Hospital, Northside Hospital, Piedmont Athens Regional, Wellstar Atlanta Medical Center South, Wellstar Douglas Hospital, Wellstar Kennestone Hospital, and West Georgia Medical Center. Yay, our 14. I see names that I know are from these hospitals. Y'all are, you need to take your moment of glory. Come off your hidden behind your camera. But congratulations, we're just thrilled with all of the hospitals, these hospitals reaching Center of Excellence, but really everyone involved in the initiative. It's just been fantastic to see the work that's been put in. Next up is the this award is Spirit of Excellence Award, and it goes to 2 individuals who made outstanding contributions to maternal and neonatal outreach education through their leadership, service, and education. The award winners are Jennifer Boland and Carla Morton of Atrium Health Navicent. Yay! Jennifer and Carla consistently go above and beyond to develop, implement, and evaluate outreach education programs for hospitals within their region, and they support other RPCs across the state with the expressed goal of improving outcomes for mothers and babies. So thank you, and congratulations, Jennifer and Carla. And finally, the Speak Up Health Equity Champion Award. As you all know, the lens through which we do our QI work is equity, and we have significant disparities to overcome in our state. To build capacity to address the racial disparities, GaPQC developed a partnership with the Institute for Perinatal Quality Improvement to offer Speak Up training. This training has been extremely valuable for our hospital teams. I know many of you have participated in those trainings. Many hospitals and organizations have participated and are committed to building capacity to address racism and ensure equity in perinatal outcomes. The Speak Up Health Equity Award was presented to Andrea Young-Kellum with the Healthcare Georgia Foundation. Andrea produced the biggest increase of Speak Up champions within our organization, and she's truly dedicated to equity for all people. So we ran through those, but we wanted to make sure we recognized everybody. Just incredible work done. Just yay for all of our accomplishments, all of your accomplishments. I love all the clapping in the both on camera and in the chat. I'm going to put up the QR code again if you want to submit your interest in the Optimizing Nutrition initiative, or email me with any questions, or if you're interested in being in the planning group. We appreciate you all. We appreciate your time today, and we'll see you, I guess, again in January. So enjoy the rest of your year. Somehow we're there. Bye, everybody. Have a good day.
Thank you.